All, including you. You are joining your conference as a participant. For a menu of available commands, press *#.
Good afternoon and welcome to FEMA Region 2 and Community Preparedness webinar series. My name is Allison Albright and I'm the Regional Preparedness Liaison for FEMA Region 2. I'm going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned. The archived event will be available on the FEMA website in the coming weeks. You should hear audio through your computer speakers, so please ensure that your volume is turned up so you may hear the proceedings accordingly. In the top right corner, we ask if you'd like to receive news and updates from Region 2. If so, please enter your email address and we'll be sure to add you to the distribution list. We will have a question and answer session after the presentation concludes. You'll see a Q&A pod in the lower right-hand corner. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Finally, the PowerPoint presentation from today will be available for you to download in the file share pod as a PDF. You click on the file and download it using the download button. With that, I'd like to turn it over to Lourdes Provera from our Caribbean Area Office to introduce our speaker in today's proceedings.
Hi, good afternoon. Thank you, Alison. We would like to mention that in FEMA's 4-year strategic plan, the agency's first goal is to build a culture of preparedness. Region 2 individual and community preparedness program is focused on preparing individuals and communities for disaster by providing adequate information and training, inspiring people to take action and be ready for any emergency. As part of that goal, we are pleased to host today's webinar about the COVID-19 pandemic by learning more on how the disease spreads and affects people and communities. Mr. Craig Medley from Nova Southeastern University and NSU, following the Center of Disease Control and Prevention, CDC, guidance, will explain information about COVID-19, the origin of the virus, evolution of the disease, important and the consequence of not getting the vaccine, needs, and much more. Professor Craig Medley is a retired captain with 32 years of service from the Miami-Dade Fire Rescue Department. He retired in 2018. He has a total of 38 years in the fire service and is a firefighter paramedic. Craig served the last 18 years with Miami-Dade Fire Rescue as the captain of the hazardous material unit. He has been a hazmat technician since 1985. He has served as the hazmat team manager and instructor for Miami-Dade's Urban Search and Rescue Team, FEMA Florida Task Force Number 1, and has been deployed internationally and domestically to disaster. Craig has many years of experience instructing in pre-hospital emergency medicine, weapons of mass destruction, and hazardous material responses. Mr. Medley is a contract instructor for private organizations in hazmat and WMD courses. He also takes pride in keeping current with his technical certification and is a dedicated trainer and the director of curriculum development for Nova Southeastern University in Fort Lauderdale, Florida. Please, Mr. Medley, the micro is yours. Thank you.
Hi, good afternoon, everybody. So this afternoon, I'm sorry, we're going to go through a program that was developed by the NIEHS, but it is it's an abbreviated version for this hour, but we're going to touch on the highlights for particularly Puerto Rico and talk about vaccination and the COVID numbers and things like that, and also ways to help protect not only you as a person, but also how businesses can basically respond and work through this COVID crisis. So with that, I just want to make sure, do I have control to be able to move the slides? Or is that done by somebody there?
No, sir. You can do it at the bottom.
Okay, great.
You can
I
have
just
to
want to make sure.
Go ahead.
Okay, all right. So, so the program that we teach at Nova Southeastern University is it's from the NIHS. It's actually a 4-hour segment, but because we're doing the 1-hour seminar, we're going to touch on the highlights and talk about some specifics, especially with Puerto Rico. So the goal is to increase safety and health awareness for responders, because we do have responders that take the program, and also workers when they're with potential exposures to COVID-19. We'll talk about the basic facts of it. We'll talk about some workplace exposure, some of the risks there, and key steps for worker protection. And we'll talk about methods to prevent and respond to COVID-19 exposure in the workplace. So just to caution everybody, what this is not, it's not sufficient training by itself, especially if you have occupational exposure or expect to with people with COVID-19, such as healthcare, first responders, and people that work in facilities, that they'll definitely have people with COVID-19. So with that, those personnel must have specific training in their use of their PPE, and donning and doffing, that's taking on and putting on their PPE. So they have to have training in that and be very proficient in it. So this is not what this course is meant for. So it is a basic, and for people that do have that exposure, should definitely have the hands-on training and become confident with their PPE. So we all know information on COVID-19 is changing rapidly. I actually had to adjust the slides today. I was very busy over the weekend, and within the last week or so, the Johnson & Johnson vaccine was approved by the FDA for emergency use authorization. So I actually had to add that in there. So things are really changing rapidly. We all know that. So we really should pay attention. Oh, sorry, sitting on the wrong slide. To reliable information such as CDC, OSHA, NIOSH, your state, local, territorial health departments, and reviewed science publications to stay up to date on this disease, which is changing rapidly. The treatment for COVID-19, as far as the way they manage in hospitals, has changed dramatically from our first cases to now. So employer and worker responsibility. Employers and workers have responsibility under the OSH Act. They basically, that's the Occupational Safety and Health Act. It requires that employers provide a safe and healthy workplace free of recognized hazards and follow OSHA standards. So that doesn't mean that it's a workplace that's totally safe. It means it's a workplace that they see the hazards. They basically provide ways to mitigate those hazards and protect the employee. So workers should participate in the development and implementation of their employer safety program. So if we're going to have a safety program, it's good to have everybody involved so that we get all sides of the issue, so that we can enact it and have a really comprehensive safety program. So you have a right as a person to speak up, to file a complaint with OSHA. The state, local, health department, the mayor, the police, anybody want, you have that right to. We always say try to work through it. I mean, especially with your employer, but some places we know with what's going on now, you may be someplace else and there may be an issue that you have to contact somebody and explain what is going on, with maybe a particular business or something. So that you have that right. So this is a link to the World Health Organization that shows the latest global numbers. This may, for your business, for your organization, for your personal knowledge, this has a lot of statistics. It keeps up to date, and it just it shows the worldwide trends now. Now, of course, they can only put in the data that they receive. Some data from some places is better than others, but it gives us an idea of the trend of what's going on with the virus. So the global situation as of now from the start, 113,820,168 confirmed cases. Unfortunately, there's been over 2,527,891 deaths. Then it goes into region. So this is a really good reference for, for your business or whatever, but they update this on a continual basis. So let's take a look at the situation in Puerto Rico as it stands now. Okay, my link. I don't know why this link isn't working. I'm gonna go back to the World Health Organization site because that is where it's from. Back in the search part. Here we go. Here's Puerto Rico. Okay, currently 100,297 confirmed cases. Unfortunately, 2,036 deaths. So you can actually go back in history and look at the different dates on this also. That's currently the data that's received by the World Health Organization. This. Am I still connected via the phone?
Yes, we can hear you.
Yes, sir.
Okay, I pushed the wrong button. Let me get back there. I apologize. Jump back in. I'm not an expert in Adobe. We mainly use Zoom, so I apologize.
You are doing great.
Okay, here we go. So as individuals, what can we do? What can we do? Of course, we stay informed, maintain our social distancing, and at least 6 feet. If you have that ability to do more than 6 feet, that's great. Wash your hands frequently. Use alcohol-based hand sanitizer, especially if you don't have access to clean soap and water. Avoid touching your eyes, nose, and mouth. That's very important. Although the disease is, the vast majority of times is transmitted through the respiratory tract, there are times you could have secretions that you touched maybe a doorknob or something, and then you touched your face without washing your hands first, so you want to be very careful with that. And stay at home when you're sick. Cough or sneeze into a tissue or your elbow. Clean and disinfect frequently touched objects, such as our cell phones. Okay, just like Mom told us, we want to always wash our hands, clean things. Be prepared if your child's school, daycare facility, or work site are temporarily closed. Be prepared if one of your family members contracts it, because then you may not be able to go to your work, especially if you've been around them. So there's a lot of those things. So it's something you always want to have a plan. Now this is a website that we added on here because there was a big hand sanitizer recall back in July, and it's been updated by the FDA frequently. There were some hand sanitizers came in. They had wood alcohol or methanol, so not good for you to use. I'm unable to get the link to work. So, but it's an FDA site, and if you want to copy this link, then it has a search mechanism, and you could search with whatever hand sanitizer you're using to see if they're on that list. Now, this came out in July, and August we started talking about it. And I didn't even check my own hand sanitizer until like October. And guess what? I was using a recalled one, and I've been using it for a couple of months. So that was something that, was, especially because I was aware of it, was not a good idea on my part. But the other thing is there actually have been some people burned because they're using these alcohol-based hand sanitizers, and they're getting next to open flame before they're completely dried on their hands. So you always want to be careful with that. People are so busy these days, and people are washing their hands, it seems like, which is good, a lot more, and they might get close to an open flame, so we want to be careful with that. So, and although this seems kind of silly, we really should look at the steps to wash your hands, because it's not just put a little soap and water and then rinse it off. It's, of course, wet your hands with clean running water, warm or cold, turn off the tap, and apply soap. Lather your hands by rubbing them together between your fingers and under your nails. I do to my wrists, and scrub for at least 20 seconds. And they have this they basically tell you if you don't know have a timer, you just you can hum "Happy Birthday" from beginning to end twice. That's about 20 seconds. And then rinse your water, rinse your hands with clean water, dry your hands, clean towel or tissue or whatever, and dispose of it properly. And, you know, as far as the virus itself, we know that's very contagious.